All right, hello folks and welcome. Trevor Mashak here, and for today's lecture we're going to be talking about various medical emergencies and how to manage those in the wilderness setting. Now obviously this is a huge, expansive topic, and so we're really just going to spend an hour or so talking about some of the very common medical emergencies that we see and talk about how to manage those at a first aid level. So things that we'll be talking about heart attacks, coronary artery disease, so most things cardiovascular that we see that are very common. We'll talk about stroke, about asthma, seizures, and some abdominal complaints, but really, just trying to encompass the really common things that we see, and so that you guys know how to recognize those things. So certainly in this lecture, we really want to kind of have a real basic understanding of what we call the pathophysiology. So I know that that's a really big word, and really what that word means is what is going on with these medical emergencies, why they're emergencies, what they cause, and what the complications of those pathways is. Think of it as like the pathway that happens within you when you have any of these diseases occurring. We're going to really have a big emphasis on recognition. Really, if you can learn how to recognize these emergencies and have an index of suspicion that an emergency might be going on, then that's a win. That's really what we're trying to gain at the first aid level. And then we will talk about specific management techniques, things that you need to think about, things that you can do kind of at the wilderness first aid level. So with that, let's go ahead and just jump right into it. So up first, let's talk about coronary artery disease. So broadly speaking, this is a disease where you have the arteries within your heart. We call these your coronary arteries. They're the blood vessels that actually supply the heart with blood flow. So it's kind of interesting. You think of like this pump that's pumping blood, it has to receive blood itself. So it has its own circulation system. It's the coronary artery system, blood circulation system. And what happens is over time, we can develop this plaque, this buildup within those arteries that serve the heart. This is something that happens in all the arteries throughout the body, but where we really have consequences are here in the heart, because the heart requires a lot of oxygen. It requires a lot of nutrients. This thing is constantly pumping our entire life, hopefully, right? Because if it stops, we run into obvious problems. So it's very, very dependent on constant blood flow, constant fuel, if you think about it that way. And so what happens is, as these very small arteries start to develop a little bit of plaque buildup, we start reducing that blood flow. And so we can have a number of problems that we'll talk about, but this is pretty much the source of it. And it happens throughout our life. So, the older you are, the more likely you are to have plaque buildup and have these arteries that are narrower because they build up on the inside. And certainly a lot of other things come into play here. So risk factors in addition to age, lifestyle. So people that have a sedentary lifestyle, which is very common this day and age as technology improves and we work less outside and we have less active working lives. And then also just thinking about people's general lifestyles, with television and things like that, people just generally speaking aren't quite as active. And also along with lifestyle, we think about dietary things. So the more kind of processed foods that people eat, the more likely they are to have this kind of buildup happen. There's a lot of question about cholesterol. Cholesterol is always kind of receiving this big focus, and it matters what type of cholesterol it is, low density, high density. It gets pretty complicated, but we know that just generally speaking, high fat diets, especially from like meats like beef, things like that, and fried food, we already know these things. But those can definitely influence the likelihood that you have this kind of buildup within your arteries. Other risk factors. So genetics is probably one of the bigger ones out there. So if coronary artery disease runs in the family, if there's a history of the parents or grandparents or sisters, anyone having this disease, the likelihood that that individual has it goes up dramatically. A lot of this comes down to genetics, so kind of out of our hands. We would consider this a risk factor that we can't control. Smoking, of course, has a high correlation with coronary artery disease. So if the individual smokes or has a history of smoking, then certainly we have an increased risk for this. High blood pressure is a big one. And then diabetes. So people that have diabetes we'll talk about a little bit later, but generally speaking, when people have diabetes and they kind of constantly have this, they live in this state of high blood sugar, the vasculature, the blood vessels in your heart, in your brain, in your extremities, kind of everywhere, starts to suffer from that sugar. And so diabetes is certainly a risk factor for coronary artery disease. So what are the specific issues that we see with coronary artery disease? So the first one we'll talk about is angina pectoris, which is just a fancy medical term for chest pain. And so what we're actually seeing with angina pectoris is that these people have a partial occlusion of those coronary arteries. So if we jumped back to that slide that we had earlier, what you would see is that the artery isn't completely blocked. It has like a small opening, but that just means that the available blood flow is diminished. So the way that I think of this is, if you've ever had like really old water pipes in your house that were like galvanized steel, those water pipes get really corroded on the inside and your water pressure goes down. And so if you have someone in a house like that who's like running a shower while the dishwasher is also going, then you go to like fill up your cup of water at the sink and there's just like this tiny trickle of water because there's just not enough water flowing through those pipes. So the same thing happens here. And basically what happens is because the reduced blood flow, this person does okay when they're just hanging out and they're sitting there, no big deal. But if they exert themselves or if they're like doing yard work, kind of a classic example, or maybe they're hiking on the trail and they've increased that demand, they've turned on all the water faucets in the house and there's a greater demand for water. In this case, they're exerting themselves, so there's greater demand throughout their body for blood flow. Now their heart can't keep up with that. And so that causes chest pain. And so that's the source of the chest pain. They just, their heart can't keep up. Their heart isn't getting the blood flow that it needs for the work that it's producing, and so that heart muscle starts to hurt. Generally speaking, these people that have angina pectoris, the chest pain will get better with rest. So if they just like sit down, they take a breather, wait for half an hour or so, that chest pain will usually relieve spontaneously. Also, these individuals, after they've gone to the doctor a few times, they might be prescribed nitroglycerin. So it comes in 2 different flavors. This medication can come as a tab, or a little tablet that they put underneath the tongue and it just dissolves and goes directly into the bloodstream, or it comes in a little spray, a little spray bottle. They also just spray this directly under the tongue for rapid absorption. Nitroglycerin is a medication that causes those blood vessels to dilate, so they open up, and that improves the blood flow to those areas that normally might not be seeing enough blood. And oftentimes that opening of the blood vessels causes an increased blood flow, so the chest pain will go away. So two things that will help these people that will cause the chest pain to go away is the rest, so they cease whatever exertional activity it was that they had when the chest pain started, or nitroglycerin. You should recognize that when people take nitroglycerin, well, there's a couple things we need to talk about. So nitroglycerin, because it causes your blood vessels to open up, that happens throughout your entire body. And so this causes your blood pressure to actually go down. And this can be significant. Some people can actually become dizzy. They might actually like faint because their blood pressure goes down. Usually if you lay them down, this issue is resolved, and it's usually not that long lasting. But this is really important because nitroglycerin can actually be absorbed through your skin. And so if you, as a person who is helping someone, handles their medication, either because you handle the tablet directly on your fingertips, or sometimes these spray bottles will break and you'll leak a little bit on your skin, you are absorbing that medication through your skin, and so you are at risk for having your blood pressure drop. And so it's always good anytime you're providing any patient care to always put medical gloves on, but especially if this stuff is around, be very, very careful. It's not like it's going to be life-threatening, but it could certainly be hazardous. It could cause some issues if you accidentally absorb this through the skin, especially if you took one of these bottles and it broke open and you spilt it all over you. You could actually have some serious complications from that. So it could be quite significant. Recognize that this condition, angina pectoris, is not a heart attack. These people are not having a heart attack. However, they are at risk, at a very high risk for having one. And basically the pathophysiology, the mechanism, the issue that's happening is the same, but it's not a complete blockage of the artery, so it hasn't quite progressed to a heart attack. However, they are at a very high risk for developing one. So talking about heart attacks, what are heart attacks? So the medical term is myocardial infarction. We sometimes abbreviate that as MI. In medicine, we love using abbreviations. So that's a good one to recognize. But layperson terms, we just call this a heart attack. And so what happens is you have a complete occlusion, a complete block of blood flow in that coronary artery, and that leads to an area, a region of the heart actually dying. We call that an infarction. When tissue dies, that's infarcted tissue. And so there's that word right there if you want to see how it's spelt. And so when that tissue dies, it can no longer, it's not going to rejuvenate. That tissue is dead forever. And if this goes on long enough, if this spreads, if that infarcted area, that dead area, continues to spread, what can happen is these people can go into sudden cardiac arrest. I think there's an important distinction here, though, because a lot of people think that a heart attack is the same as cardiac arrest. These are two different terms. Certainly a heart attack can lead to cardiac arrest, but not all the time. Sometimes we intervene, sometimes we manage the heart attack, and they don't go into cardiac arrest. Sometimes the heart attack is so small because it's like one of these really small blood vessels that you just never even know. Like, people have heart attacks and they later might find out because they go to the doctor because they're like, yeah, I'm having a little bit of chest pain, whatever. But they're like, oh yeah, you had a heart attack a while ago. It could be a very old one, and the person had no complication from it. So this doesn't always lead to this, but it certainly can. And so when people have big heart attacks, when they have a big area of the heart that's affected, it will usually lead to cardiac arrest, which means that the heart stops pumping and they're not moving blood throughout their body. That is a common outcome. So high risk for cardiac arrest, and then also long-term impairment. If you have an area of the heart that stops working because it's infarcted, that person is going to have long-term complications. They'll have a heart failure, which means that their pump just isn't as effective as it needs to be. They might need a whole slew of medications. They might develop electrical issues, so the heart has basically this electrical system through the muscle that causes it to beat the way that it does. So they might have long-term issues from that. But be aware that when we talk about heart attacks, this is what we're most worried about. So, how do we recognize it? In the field, in the pre-hospital setting, angina pectoris and MI, or heart attack, we treat them the same. Even if we think that this is just angina, which is usually not life-threatening, we treat them as if it is a heart attack. Always have the highest level of suspicion, always think the worst is happening, err on the side of caution, and get them to the hospital. They need to be in an emergency department. Signs and symptoms that you see. Chest pain is a very common one, but it may or may not be present. You've probably heard of the term silent heart attack or silent myocardial infarction. So a certain percentage of people have a heart attack without having any chest pain. When do we see this? So diabetics will certainly have a higher incidence of silent heart attacks. Women, for whatever reason, have a higher incidence of silent heart attacks. And then the older you are, the older the individual, the more likely it is that it will be silent, meaning that there is no chest pain. So certainly, if someone has chest pain, this should be high level of suspicion that this might be going on, but recognize that they can have other symptoms without chest pain, and it could be a heart attack. Syncope, right here, is a fancy word for passing out, for fainting. So the person loses consciousness, and then within a few minutes, usually they regain consciousness, and when they regain consciousness, they're usually pretty alert pretty rapidly. And generally speaking, this is really important because of the incidence of silent heart attacks. If you have an individual who has a syncopal episode, they faint, and they are in that age range, really kind of greater or older than 35 years old, definitely older than 40 years old. If they faint, you should absolutely suspect that person could be having a heart attack. There are a lot of things that can cause someone to faint, such as heat illness, such as low blood sugar, dehydration, all kinds of things. But you should suspect that it could be a heart attack until proven otherwise. So I always recommend, if you have that individual and they're in the backcountry setting, maybe you're on a hike and someone of this that has these risk factors faints, and they regain consciousness and they're like, well, I want to keep hiking. I've been wanting to do this hike for a long time. No, you should really convince them otherwise. You should do your best to get them as close to a trailhead, as close to a hospital as possible, because this could be happening. Other signs and symptoms, cool, pale, and sweaty. So diaphoretic just means sweaty. If they look like that, if they're cold to the touch, if they're clammy, if they're pale, if they're sweaty, that's very common of heart attacks. Sometimes people just complain of indigestion. They have this epigastric stomach pain, and that's very common as well. And then nausea, vomiting. Another rule of thumb, if someone has chest pain and they vomit, they're pretty much having a heart attack until proven otherwise. So keep that in mind. And also keep in mind that they can have any or all of these symptoms. Sometimes people just feel sick. They just feel like they have the flu. That's what we would call an atypical or non-typical presentation, but those happen actually fairly frequently. And then this guy is kind of clutching his chest. Classically, we have people actually holding a fist to their chest. They're like, I have this pressure in my chest. They'll say, it feels like an elephant is sitting on my chest. Just this intense pressure. That's pretty classic chest pain for a heart attack. Other things that you see. So it's not always just in the chest. Sometimes the pain is also kind of in the jaw. Classically, the shoulder as well, it's the left shoulder that we generally see the pain in. Sometimes they just have pain in the back. So just realize that this chart shows all the different presentations of the pain. It's just not always in the chest. It can be in all these other areas: stomach, shoulder, jaw. It might be in the arm. All those things. If they start having pain like that in the absence of trauma, so they didn't get hit in the back, they just started developing this back pain kind of out of nowhere, you should think that it could be a heart attack. So management, so airway, breathing, circulation, all those things that we kind of talk about in our lecture on patient assessment, as well as when we practice it in our practical session, keep those things in mind. If you have oxygen, oftentimes we don't have that available, but if you have it, sure, give some oxygen. I would hazard you to be cautious with oxygen administration. Certainly back in the not so distant past, we used to put oxygen on everyone because we thought that it was a harmless thing. And there's been a lot of research in the past 5 years or so that has shown that too much oxygen is actually a bad thing, especially in patients that are having heart attacks. So sure, you can consider doing it, and I would always administer a small amount of oxygen first, unless you have other information that suggests that you should bump it up and give a lot of oxygen. But just be aware that it's not always a benign thing. You can cause further complication from giving too much oxygen. And they need to have immediate, so ALS, if we haven't already talked about that, that's advanced life support. So they need either a paramedic, a nurse, physician level care, and then they need immediate evacuation. So aspirin, just the same, aspirin that you buy over the counter at Walgreens or wherever, is extremely beneficial to these people. I don't remember the exact statistic, but usually they say that if a patient receives aspirin pretty quickly, the rate of cardiac arrest and the rate of death goes down by about 33%, which is huge considering that it's an over-the-counter medication. Now, just be aware that aspirin is out there everywhere. Everyone can get it, but that doesn't make it okay for you to give it to someone. So my recommendation as a person who is in a wilderness first aid class or has a wilderness first aid certification is, if they have their own aspirin and they want to take it, recognize that that can absolutely help them. Just be aware that you are not legally allowed to give that aspirin to someone. You can make that decision, and that's your own ethical decision there, but just realize that legally you are not allowed to give that person aspirin. Now, if they really want it and you happen to have it, then the likelihood that you're going to be sued is probably pretty low, but just recognize that there is that risk. Nitroglycerin, this is a prescription medication. So if the person has it and they want to take it, then certainly that can help. Just be aware that all those things that we talked about earlier, the risk that they might drop their blood pressure, they might faint, all those risks are there. And then this last one is pretty important. So if you suspect that someone's having a heart attack, be prepared that they might go into cardiac arrest. So be ready to start CPR. If you're not someone who has done CPR before, you don't work in a clinical setting where you do CPR often, if you have someone who's having a heart attack, just start mentally rehearsing what that means. So start thinking back to that CPR class that you took 2 years ago and try to remember what you need to prepare. If you're in a location where there is an AED, a defibrillator nearby, try to get that to the location, or try to get the person to where that might be. So if you're driving, or if you're if you're at the store, find out if there's an AED present. If you're on the trail, try to get somewhere where an AED might be present. And just be aware of where those things are. So, for instance, if you're on the La Luz Trail in the Sandia Mountains, you should know that the tram carries an AED, as well as the Crest House at the top at the parking lot. They have an AED. So just kind of know where those things are. Try to be aware of that. Try to notice those things when you're out and about, and be aware that if they have chest pain and you think they're having a heart attack, if you can get that AED there. If they go into cardiac arrest, if they all of a sudden go unresponsive, you feel for a pulse and there is no pulse, if you can put that AED on them right away and shock them, they have a much better outcome. They're way more likely to survive that event. Of course, that's not the end of it. They need to get to the hospital and they need to have that coronary opened up. But recognize that if you can have that AED there and ready to go, then you're in a much better spot. To put it in perspective, me as a paramedic, if I have a person who's having a heart attack and they're still conscious and with it, I take those pads, those AED pads, I just put them on their chest. So that way, if they do go into cardiac arrest, all I have to do is push the button within like 5 seconds of them going into cardiac arrest, and then their outcome is going to be much better.